skin issues cause stress, but then also stress causes skin issues. So we use this vicious cycle. Welcome to the Spa Doctor podcast, where we uncover the secrets about women's health and hormones.
I'm your host, Dr. Trevor Cates, naturopathic doctor, best-selling author, and founder of the Spa Doctor. Every episode, we reveal the best-kept secrets for achieving glowing skin, natural beauty, a healthy body, and a balanced mind. Are you ready to live your healthiest life? Keep on listening.
Welcome to the Spa Doctor podcast. I'm your host, Dr. Trevor Cates. Today, we are uncovering the link between stress and skin. Join us as we dive deep into the complexities of how stress impacts your complexion with our guest, Dr. Keira Barr. A pioneer in integrative dermatology and somatic skincare, Dr. Barr will enlighten us on the intricate connections between our emotional well-being and skincare. She is a renowned speaker, author, and podcast host, and you may have seen her in media like Mind Body Green, Glamour, Self, and Oprah Magazine. Get ready to gain valuable insights that can transform your skincare routine from the inside out.
So great to have you on the Spa Doctor podcast. Welcome.
Thank you. Thank you. It's so good to see you.
Yeah, it's good to see you too. Okay, so we're talking about stress and skin, the connection between the two, and you've been really diving deep in this. So what is it what makes you so passionate about this? Why is it so important to talk about skin and stress?
Yeah, I think because it's probably the biggest contributor and the most overlooked part of skin issues. And it's the missing piece of most skincare routines.
And why do you think that is?
Yeah, well, several reasons. I mean, if you look at all the patient support groups and things, websites like psoriasis, rosacea, eczema, I think stress is one of the most common triggers. And that is because the brain and the skin are actually linked embryologically. So they are derived from the same layer of embryologic tissue. They are talking to each other all the time. So there is a direct link between the brain and the skin. So the skin actually, just one more reason is most people, when they think about stress, they think of it as like a top down, like it's just your brain sending signals to your body. But what many people may not realize is your skin actually has its own stress response system. It has its own HPA axis in the skin. So your skin is both a target and a source of the stress response. So that's one of the biggest reasons too.
Okay, so this is a typical dermatologist thing. How did you go from being more of a conventional dermatologist to getting here?
Yeah. So basically, when poop hits the fan, in your own life, you learn very quickly that you need to do things differently. And my own skin was changing about 12 years ago. So the focus of my practice was skin cancer and melanoma. And it was, to my dismay, that my own skin was starting to change, growing and changing pigmented lesions until one we biopsied was melanoma. And so that really was a wake-up call to me that how I was navigating my life, thinking I'm doing all these things right, was not right for me. And that led to gut issues, hormone issues, and kind of just a snowball effect. And it led me down the path towards integrative functional medicine, ultimately mind-body medicine, and the light bulb went off that the root of all of the health issues I was really struggling with was a dysregulated nervous system and the impact of chronic and traumatic stress in my body.
Wow. Yeah. And, I had skin issues as a child. I had eczema, and it definitely wasn't something then that anybody talked about. Nobody asked me, like, are you stressed? You're a kid. So, do you think this is something that people are becoming more aware of, or are you just really hoping to pave the way for this?
In the field of dermatology, I think I'm hoping to pave the way for this. That being said, in the broader stratosphere, if you're on social media, you'll see there's a lot of people talking about trauma. You will see a lot of people talking about a body-oriented or somatic approach. But it's funny that my mentor, so I've been diving deep into this area with pioneers in the field like Drs. Bessel van der Kolk and Gabor Mate and Pat Ogden and Peter Levine. These are the people that I am learning from. They're in their 80s. And they started this back like when they were in their 40s or 50s. Like, it's taken a while now for this to catch on. My hope is that in the field of dermatology, because the door is open, it won't take as long. Because if you ask any person who's struggling with a skin issue, especially we live in a society that puts so much emphasis on our physical appearance, that there is so much, stigma and shame and anxiety and overwhelm that comes along with a skin issue, that most people's dermatologists are not opening that door to ask them how they're doing and what support they might need around that. And that's where, I'm hoping to fill that gap for them, because it's so, so important.
Yes, it is. And we know how stressful skin issues can be, chronic skin issues in particular. I remember it so well as a kid and feeling embarrassed by my skin. I didn't want kids to get too close to me. If they did, they would notice things with my skin and say something. Kids are brutal. They can be so brutal. And I've seen it in my practice with my patients, people with eczema. Also, acne is a big one where it's so debilitating for people, and they don't know when it's going to show up, and they think that they are going to be labeled or judged by the look of their skin, and that can be very stressful. So skin issues cause stress, but then also stress causes skin issues. So we use this vicious cycle.
It totally is. And I talk about this all the time. In fact, the chapter that I wrote in the Integrative textbook of dermatology was specifically on acne and rosacea. And acne is, a skin issue that 85% of the population will experience some form of it at some time. So it's really prevalent. And it gets overlooked and dismissed all the time because the clinician may think, oh, you've got a mild case. To the person who is living with it, it can feel catastrophic and devastating. And so we really need to take that into account too. So yes, there are the stressors in our life that can turn on the stress response and the inflammation and the stress hormones, cause a flare of the condition. And then the flare of that condition, like you said, can cause feelings of shame and low self-esteem and confidence. And it just keeps that cycle going. And so we can break that cycle. We can invite a different relationship to our response to stress that is, can break that cycle and help your skin heal from the inside out.
Let's break down the stress response a little bit. Can you walk us through the stress response? What happens chemically, biologically, physiologically in the body?
Yeah. So I think the biggest thing, any myth to debunk, is stress isn't a bad thing. Stress is a normal biologic adaptation. We need stress, right? There's eustress, that good stress, like when you're going on vacation. There's tolerable stress, the things we just have to deal with, like paying our bills, emails. And then there's the distress. And so really, our stress response is just readying us to take action. It's preparing us to do something. The problem is when our capacity to handle whatever the stressor might be, that's when we kind of go into these survival coping strategies that most people might know as the fight or flight response or the freeze response. And normally when we're experiencing activation of that stress response, and we're in one of those patterns, what's supposed to happen is when that stressor, subsides, we deal with it, we're supposed to be able to come back into what we call our window of capacity. The problem is so many of us get caught in those survival coping strategies. We get caught in a state of fight or flight or the shutdown. And so when that happens, when we activate that stress response, our stress hormones go up, cortisol and adrenaline, and that sends signals to our body to release inflammatory signaling and markers that are intended in service of our survival to keep us safe. But when the switch is kept on, that inflammation, those hormones are still cycling around. And that's what leads to chronic inflammation, pain, that manifests clinically as hair loss, acne, eczema, psoriasis, autoimmune conditions.
Yeah. Okay. So we talked about, thank you for explaining that. We talked about eczema, acne, you mentioned rosacea. What any other skin conditions that are things that people need to look out for if it's a sign that their stress level is just too much?
Yeah, so there's more research coming forward. I think the shift in medicine was like chronic inflammation is the root of all disease, right? What is driving that inflammation? Dysregulation of the nervous system, which is a result of our system's stress response kind of being in overdrive. So I would say that any skin issue has an underpinning of, a stress response, but acne, rosacea, psoriasis, hair loss, right? So women who are experiencing hair loss, exacerbation of your menopausal symptoms, hot flashes, fatigue, sweats, but also accelerated fine lines and wrinkles. People always want, like, what is the latest anti-aging cream, serum, salve? And I'm always like, those are nice, but you know what's going to help you age a lot slower? Slowing down, finding things that bring you joy, sleeping well, moving well, and like learning how to nourish your nervous system. That is like the greatest anti-aging strategy ever.
Nourish your nervous system. Let's talk about, how do you nourish your nervous system?
Yeah, I think the number one thing is, we are wired with 3 kind of primary factors into our DNA. It's like slowing down. We were not meant to live in hustle culture. Unfortunately, we've overridden our natural tendencies. Connection, right? We are wired for connection. And the third is a felt sense of safety. In service of our survival, creating a felt sense of safety will always come first. And the other 2 will take a back seat. So nourishing your nervous system is creating an environment that helps create that felt sense of safety. It's your physical environment. I'm just looking around my space, like simple things like clutter. And what is your visual, like what's in your social media feed, right? Are there things literally that you look at that when you look at them, you can just feel your energy level go from like 100 to 0, right? And things in like our internal environment, right? Paying attention to our breath and our posture and our position. There are a lot of different tips, tools, and skills that take very little time that I teach my clients that can make a significant impact. But helping yourself create a felt sense of safety is number one.
Number 1, creating safety. Yeah. And so, I mean, that's an interesting thing. And you've mentioned trauma. And I know there's a lot of talk on trauma, right? There's a huge range of what trauma means. When you say trauma, what does that mean to you?
Yeah, I think, we've come to understand that trauma isn't the specific event. Certainly there's shock trauma where there's an accident, like there is an event. But for the most part, when we think about trauma more globally, it's anything that overwhelms our nervous system's capacity to deal with it. It's overwhelming our system.
Yep. And so we've got stress, chronic stress. There's acute stress, which may or may not trigger a skin issue, but it's really that chronic unmanaged stress. And then there's trauma. In the body, how do we interpret those things? Does our body respond differently?
It responds very much in the same way. So essentially, acute stress, right? Whether, for instance, like bring it into the skin realm. For many people, a sunburn or kind of acute sun exposure may be a trigger for cold sores, herpes, right? So that you get this acute exposure, you break out, that heals, and then the herpes virus goes back to hiding in your nerve root. Okay. But chronic is, it's more of that chronic ongoing stress of you're in a toxic relationship. You really don't like your job. You feel like you don't have voice, choice, or kind of a sense of power over what's happening. And that keeps your nervous system in a state of feeling unsafe. So there's this chronic stress that your body is responding to that if it goes on long enough, this is where trauma happens. So trauma happens in a setting of when it's too much, too fast, too soon, or if it's going on for too long with too little support. In both of those situations, it can overwhelm your system. And so you stay stuck in either kind of that fight, flight, or freeze, or when that way of trying to cope with things doesn't work, many of us can go kind of down into that shutdown, that feeling in despair, fatigue, kind of feeling like we just feel stuck in the mud.
Yeah. Is there any emerging research that is really shining light on this?
Yeah, so I would say I'm hoping that I'll be able to shine some light on it. I've got 2 IRB approval studies pending that we can take people through my program dealing with their skin issue and kind of look to see, can we make an impact? But there is a lot of emerging research, especially in the skin literature. Psychodermatology is an established subspecialty of derm. It is the intersection of mental health and skin health. We have known for such a long time that there is this connection. And there are more studies coming out about the impact of childhood trauma on conditions like psoriasis, vitiligo, eczema. I presented at the American Academy of Dermatology all about the impact of chronic and traumatic stress on cancer, skin cancer specifically. Skin cancer is the most common cancer, in the US. And so there is research on this. And there are studies on using mind-body interventions, breathwork, meditation, biofeedback, relaxation. And there is a study on using somatic experiencing in particular to help regulate the nervous system. And so there have been quality of life improvements. People have had improvements in their visible conditions, in their chronic symptoms. So yes, there is more and more. We just need to bring it to the forefront.
I think this is so important. I also think it can sometimes be overwhelming because we can't escape stress. And we can't, for the most part, I'm like, who isn't traumatized in some way? It's really sad, but it's true. Even if we don't have any kind of sexual, physical, even medical trauma, there's generational trauma. From every person has that within their family. So, and that can just be this burden that a lot of people carry. So is there really a way to do this? Where do people start? Because like meditation and mindfulness, and it's like, oh, that sounds complicated for a lot of people, right?
And it can sound woo-woo and can sound like BS and like, that's not going to work for me. But I would say it's rooted in science, right? We look at the neuroscience, we look at neuroplasticity, we look at starting where you are. And so it's not all doom and gloom. And there is a way, there is a different way. But the first part of it is that awareness, right? When I've asked some of my clients, like, what are they noticing in their body? They're like, what body? I don't know. Like, they're always in their head. And that was a good thing for a long time in their life. It kept them safe, right? They could stay out of their body where the emotions were uncomfortable. But through very simple practices, we can teach ourselves how to rewire these patterns, these neural networks through very, very simple things. Like literally, like I'm changing just changing the way you're sitting, right? From a slumped over position to just, if you have little kids who, or no kid, like the Legos or stacked blocks one on top of the other, and just imagine that your spine is doing that. And just notice what happens as you sit up a little straighter. For myself, I can just feel like I could take a bigger breath. It's easier to take an exhale. I feel a little bit more spacious. It could be that simple. You're teaching your body a different way. Even just changing your position. Looking to the left, you see one, set of items. You look to the right, and it's a whole nother perspective, right? You start with these simple things, and then we apply them to other parts of your life. There is no way that we are going to get rid of stress, nor would we want to. The intention of all of this is, can you change your relationship to how you navigate stress in your life? So it can feel more easeful. You feel more grounded. You increase your capacity to be able to handle things without getting overwhelmed by them.
And I could feel that when I changed my posture too. I did yoga teacher direct training recently. And so I'm more body aware than I mean, I always have been to a certain extent, but it is true. It's so true. The way we move our bodies and our posture with giving space for our lungs. And breath work is so incredibly important. It's something that we do without thinking about it, right? Our heartbeats, or we breathe without thinking about it. We do, these things happen. But are we breathing optimally in a way that can help with managing stress? It is such a powerful tool that we have at all times.
It's so true. There's so many things. Like, we walk around in this body. Let's leverage how it can support us, right? Your breath is a perfect example, right? It's something that we do unconsciously, but when we bring it into our conscious awareness, even noticing if we're breathing, when we're stressed, many of us just hold our breath. And just bringing that awareness to breathe again so you can oxygenate your cells. Like, the stress, the trauma, like, it affects our physiology on a cellular level. It affects our physiology and it affects our psychology. And we can shift our physiology. That'll help shift the way we think about things, right? So much, people think, I can think, mindset work, I can think my way out of this, but you can't really think your way out of many things, because only 20% of the signals that are really controlling your thoughts, sensations, and emotions are from your brain to your body. 75 to 80% of the signals that are actually controlling how we think, feel, and respond are coming from the body to the brain through that vagus nerve that informs the brain and then sends a signal back down to your body. So it really is that integration of kind of that top-down and bottom-up approach to really optimize, like, creating more ease in living in the skin of ours.
Can you touch on that vagus nerve and why that vagus nerve is so important in the stress response?
Yeah, so the vagus nerve is called the Great Wanderer. So it starts at the base of our neck and it wanders through the nerves on our face in terms of facial expression. And this is, again, that whole idea of connection. That is how we connect and engage through branches of the vagus nerve. Those familiar with the polyvagal theory, our throat, our voice, our heart, our gut, and then those signals go back, and wander back up to the top. So many of the gut issues, when people are always talking about, oh, heal the gut, leaky gut, take this supplement, do this diet, really, there's been a dysregulation in the nervous system that has impacted the signaling that's coming from that vagus nerve back up to the brain. So the vagus nerve is so important in helping to regulate the signals coming from our autonomic nervous system, the sympathetic, right, which lets us get ready to take action, and the parasympathetic branch that allows us to experience more rest, digest, and restoration, which we can influence through the way we breathe.
So what are some of your favorite ways to stimulate the vagus nerve, or do you have some that you like?
So breath work is definitely one of them. When we want to kind of bring, it depends on, you have to check in with where you are, knowing, where you are. If you are feeling more revved up or you're feeling a little bit more shut down, it's going to kind of dictate what kind of breath work would be most supportive. But I think when we think about breath work, it's more of that, I'm feeling a little buzzy and anxious. I want to bring my system into a little bit more calm state. So just a simple inhale through the nose and an extra long exhale through the mouth. And so that has been, doing that 3 to 5 times. And that really activates that vagus nerve, stimulates the vagus nerve, bringing our bodies into a state of rest and relaxation. There's different techniques of, coherence breathing or balance breathing, of inhaling for a count of 4 or 5, exhaling for a count of 4 or 5. There's so many different flavors, but things that are really, really simple that you can be doing when you're driving in your car, when you're standing in the grocery line, when you are, scrolling on social media. These are things you can do anytime, anywhere.
You mentioned neuroplasticity a moment ago. Can you explain what that is? Because I think that's important for people to understand behavior and how, we can change our behavior.
Yeah. So a lot of our patterns, it's kind of, if you think about a highway and there's the freeway, like it's the main road and you've been driving down that road for a really long time. It's familiar and the traffic always goes in that direction. That's kind of like our habits or patterns that are wired, these neural networks. But there's always a possibility. I don't know where you live, but there's always construction going on our roads, right? There's always they're creating a new off-ramp. There's always construction. And it might slow things down a little bit, but eventually you're going to get where you're going to go with new possibilities. Like there's a new route now to take. Similar thing with neuroplasticity. There's that main highway, the way we've been doing things over and over and over again. But we can teach ourselves new habits, a new way of doing things, whether it's the way we move our bodies, the way we're breathing, and we're creating that off-ramp. And at first it's going to feel a little wonky. There's the cones and there may be a little bit more traffic, but eventually that road gets paved and it's an easy exit. And then that becomes your new normal, right? We talk about, neurons that fire together, they're wired together. That was the main highway. We are now creating another opportunity for new neural networks, for other things to wire together. But it takes consistency and practice and commitment and a belief that things can be differently. I think that's the biggest thing is, believing and having a sense of optimism that things can change, and also having the support, the time, and some guidance to do so as well.
Yes. And I've definitely noticed this within my own lives and my patients that sometimes it's hard to start making these changes, like being aware of your breath and taking that time to really take that long inhale and long exhale. Another thing that I did for a while was gratitude journaling, and I made myself do it every single day. So, and I didn't want to miss a day, but occasionally I did. But after doing it for a couple months, I felt like if I didn't actually write something that I was grateful for in my journal, then I would feel like my day wasn't complete. So it was creating that new neural pathway, right? Yeah. And just simple habits like that, if we just get used to them. And I also think of skincare routine, right? We do that oftentimes because we want our skin to look good. But what if you turn something like that into a stress management practice where you're taking your time, you're enjoying the sense of the organic essential oils or the natural plant oils, and you're breathing and really loving on yourself during that process?
Totally. And I teach my clients that as well. It's, make it this ritual, and feeling your feet on the ground as you're washing your hands, feel the temperature of the water on your skin, lathering up, your cleanser and the soothing self-touch. There's a real power in that, right? There are what we call tactile fibers on the surface of our skin that are directly linked to a center in our brain that regulates our emotions, right? There's release of the love hormone, oxytocin, from touch. You can offer that to yourself, and you're not having to take any extra time, right? You're already washing your face. You're already brushing your teeth. So maybe slowing down how you're moving the brush in your mouth and paying attention to your breath. You can incorporate these things really, really easily. And to your point of, doing something consistently, I want to offer, sometimes we can overload ourselves or overwhelm ourselves. There's a right way to do something. Right? If I don't do it every day, I've messed up. Not true, right? We want some consistency, but I'll name that, we were talking about stories and such earlier, but one of my clients, she was one who literally when I always have my clients do a particular exercise, we use art, we use all sorts of different things. But when we first started and she did this first practice, she had no concept of like what was happening in her body. Her head was completely separated. We had a session this week and she said it was the most transformational week of her life because after just a few sessions, it was the first time she got some news from her spouse that was not good news. And her normal inclination would have been to smooth things over, try and make them feel better and just, caretake. For the first time, she's like, I could feel in my body. I stood up a little bit straighter and it was a full body no. And I said, no. She said, no, I'm not going to do my usual response. I'm going to say exactly how I feel, that this isn't okay. Mind blown for her. She'd never been able to use her voice. And that is where so many conditions like hives, for instance, right? Your skin is shouting at you with these red, blotchy, welty things for so many people. And I go a little bit deeper and ask, when did this start? What's happening? In so many cases, it's they don't feel heard, they don't feel seen, they don't feel valued. And their skin is expressing that on the surface. So when we can learn the skills, tools, have the support to be able to actualize using your real voice, standing in your authentic beliefs and nature, things shift. Your skin, your physiology, your psychology, your mood, it changes.
That's so true. And we think of our skin as our barrier to the outside world, right? And if we're not, it sounds like with your patient, maybe she didn't know how to set boundaries. And I mean, I know as a child, in my youth, I wasn't taught that. I didn't know that. And I think that's partly why I didn't have I had skin issues, I think. And I see that with a lot of patients with chronic skin issues. And of course, there are other things that could be going on, but it's a symbolic thing, right? Where our skin is our boundary. It's our And if we aren't good at setting those boundaries, then maybe that's representing something in our skin.
And, you think about leaky boundaries, leaky skin, right? What are you willing to tolerate? What are you not? But especially as kids, it's really interesting. As kids, it's really hard to set boundaries. We are so dependent and reliant on the people who care for us. And this is where I'm starting to work with groups where it's the individual who is struggling with the skin issue and the caregiver. Because whether we realize it or not, right, we're always in relationship with each other and we can co-regulate or co-dysregulate each other. When the caregiver is stressed out and overwhelmed because they've got a lot of stuff on their plate, that energy, that resonance is felt by your kiddo, right? And having to manage and deal with their issues and the creams and all the things that adds more to your plate, that overwhelms you, and it can go back and forth. It's like this infinity loop. You trigger me, I trigger you. So when we talk about skincare, it's not just for the individual, right? It's all about that relationship. Skincare is about caring for who you are in this skin of yours, especially in a familial dynamic. It's taking care of all the collective members in that space and learning how to reinforce those boundaries from the outside in and the inside out.
Yeah. And it's a process, right? And it's an ongoing learning opportunity. And there's no shame in this. If you're struggling with skin issues, certainly we've been there. We understand. Just be patient with yourself, but start making some changes, right? And make some steps.
And I would just add one more thing is start with the one thing. And again, we live in a society where they glamorize quick fixes and, take this and that and you'll be good. 30 days, 60 days. When it comes to skin issues, you can't always look at your symptoms as a signal that you're healing, right? Your skin is dynamic. Things are going to change on a day-to-day basis. So like you just said, Trevor, it's about being patient and being consistent. And as you continue to incorporate maybe just one thing, maybe it's having that gratitude of what are 3 things I can be grateful for today? Or what are 3 amazing things that my skin does for me? Number 1, it, regulates my temperature, keeps me safe. I can wear cute clothes on it, whatever it is. And one of the things that you might notice is just shifting how you feel in your skin, your relationship, so that even if your skin isn't completely clear, it begins to matter less because you realize you are not your skin issue. It is just something that is happening as a signal and invitation that your body needs a little more support, a little bit more nourishing, that you're not broken, that you don't need to be fixed. You just might need a little different type of support.
Oh, that's great. And nourishment and support, and a lot of that is, we talked about stress and emotional support, but there are also ways to nourish our bodies to help with like cortisol and the stress response. So if there are any foods, any herbs, any supplements that you find are particularly helpful?
Yeah, I think always we start with the foundational principles like eating well, moving well, sleeping well, doing things that bring joy. And I would say that sleep is probably one of the most significant foundational things that we can do, because beauty sleep is real. It's not just for aesthetics. It really is a time for our body to rest, restore, balancing skin hydration, balancing the cortisol and the melatonin, which are hormones that, have an inverse relationship. Melatonin is supposed to increase at night. It is the most potent antioxidant our bodies can produce, especially for skin healing. It repairs DNA damage especially from environmental exposure like UV exposure and air pollution, helps our hair grow, all of that. So there are, sure, there are supplements. I always like to encourage practices like getting off your cell phone, like getting off your device a few hours, having your feeding window when you eat, making sure that there's a couple hours before you go to bed so that your body has time to digest that. But in terms of sleep, certain things that have been found to be really helpful are things like magnesium, right? I use a blend of magnesium and ashwagandha and L-theanine, sometimes lemon balm, either in a powdered formulation or a supplement or tea. So those are things that I found really helpful. I also wear a eye mask to block out the light. I've got blackout shades, sometimes aromatherapy, right? Setting up your environment so it becomes like a sleep sanctuary, I think, is probably whatever you feel like the texture of your sheets.
Yeah, those are all beautiful things. That sleep is just that it can become a bit of a routine that we forget about, but it also can be a ritual that we cherish, right? And so I love that. And you mentioned ashwagandha, which is an adaptogenic herb, right? Which helps with the stress response and cortisol. And there are other adaptogenic herbs too, right? That can be helpful and helping with managing stress. Again, all part of all the other things we talked about. No quick fix. Don't just go and pop those supplements. Do the other stuff too.
It's so true. And it's all about honoring our natural rhythms, right? Like sleep, why we're focusing on this is to help honor our normal rhythms, our circadian rhythms, our ultradian rhythms. And that doesn't start just when you are preparing for sleep at night. It's like from the first thing you wake up in the morning, getting some natural sunlight. People think dermatologists hate the sun. We want you to, live under a rock. That's not true. What we would like is for you to protect your skin from unnecessary excessive UV exposure, because we do know that 90% of visible signs of aging are from UV exposure. Air pollution is right behind it because there are particles that can settle in the skin and contribute to hyperpigmentation and impacting collagen in a negative way. And skin cancer, I mentioned earlier, the most common, most prevalent cancer in the US and Canada, more new cases of skin cancer than all other cancers combined in the US. And they're mostly preventable when we can, increase our stress resilience, right? UV exposure, air pollution, those are stressors. Not sleeping well is a stressor. Your skincare products can be stressors to your system if they have chemicals and ingredients that irritate your skin, break down your skin barrier, disrupt your pH so that your skin microbiome gets disrupted, right? These are important things in addition to learning practices from the inside out that we can use.
Thank you so much, Keira. Can you tell everyone where they can find you?
Yeah, so I would say my website is going through a little overhaul right now. So I would say on Instagram, I'm sharing more information about the mind-skin connection and offering, you asked, where do they start? Where do people start? I actually created a skin healing guide, nervous system regulation for skin healing, so people know exactly where to start. And there's a link to that on my Instagram bio, so they can go there, Dr. Keira Barr.
Awesome. Thank you again for being here with us. I really appreciate all your information.
Thank you for joining us today to explore the relationship between stress and skin health. If you found this episode helpful, please share it with friends or family who might find it beneficial. Follow us on Instagram and subscribe to the podcast for more insights into clean skincare and holistic health.
Thank you for listening to this week's episode of the Spa Doctor Podcast. See you next Sunday for a new episode on your journey to living your healthiest life at any age.